Okay, the last three slides of your PowerPoint on the autonomic nervous system are going to talk more specifically about how the autonomic nervous system affects particular organs. So if you look at these three slides, they're divided into a sympathetic side, which is on the left, and a parasympathetic column on the right. Uh, on the far left, we're going to look at the organs. So we're going to take organs in your body and ask the question, what do sympathetic neurons do to that organ? What do parasympathetic neurons do to that organ? And always ask yourself the why. And the why is going to help you because we know what sympathetic responses are for versus parasympathetic. Remember, sympathetic responses are for helping with a crisis, help with a physical stress on the body, help with a stressful environment, versus parasympathetic is all about resting, restoring the body. So let's start with the heart, because the heart, I think, is a pretty straightforward one. Heart has neurons that are sympathetic and has neurons that are parasympathetic. The sympathetic neurons increase the heart rate, increase the force of muscle contractions, and those neurons are going to be releasing norepinephrine, which bind to beta-1 receptors. So beta-1 receptors are the receptors on your heart that are stimulated by sympathetic neurons. Now, this is an important one clinically because we have drugs that are called beta blockers. And beta blockers block this process. So if we were to put a big X through this process, that'll tell you what beta blockers do. They don't increase the heart rate, they decrease the heart rate. They don't increase the force of the heart contractions, they decrease the force of the heart contractions. So beta blockers are used to kind of relieve the heart. Quite often a sick heart works too hard. So if we have a patient that has cardiovascular problems and that heart is working too hard, they can administer and give that patient beta blockers to relieve that heart. Parasympathetic, what does it do? Well, it does the opposite. It decreases heart rate, decreases force of contractions, and it does this by targeting muscarinic acetylcholine receptors. Okay, next organs are blood vessels. Blood vessels are sympathetically innervated and not parasympathetically innervated. What do the sympathetic neurons do? They cause what we call vasoconstriction. So that takes these blood vessels and makes them smaller, constricts them. And what that helps us do is ultimately it helps increase our blood pressure, which again is a sympathetic response. Now again, this is important clinically because we have what's called alpha blockers. Alpha blockers block these alpha-1 receptors. So if you block vasoconstriction, you vasodilate, and instead of increasing blood pressure, you will decrease blood pressure. So a lot of our blood pressure medications act by blocking these alpha receptors, which would ultimately help lower blood pressure. Okay, now let's talk about energy. And remember, basic, sympathetic, we want to increase energy. Parasympathetic, we want to store energy. So that's the big thing to remember. If you can remember sympathetic responses, we need more energy, you should be able to answer the question why under all these. Parasympathetic, we want to store energy. So what does adipose tissue do? Sympathetic neurons cause lipolysis. So lysis means break, lipo means fat. So we are breaking down fat to release the energy from it. Parasympathetic, no known effect on adipose tissue. Sympathetic responses on the liver include releasing glucose. So we haven't talked about the liver. We talk about it a lot in AMP2. But one thing we know about the liver is it is a way we store glucose. So the liver is kind of like adipose tissue in that it can store energy, but it doesn't store it as fat. It stores it as glycogen. Remember glycogen? Hopefully you're remembering that it's found in skeletal muscles. It's also found in your liver. So if we need glucose, if we need to raise our blood sugar, we can tell the liver to undergo glycogenolysis. Glycogen, breaking glycogen. You break down glycogen, you release glucose into the bloodstream. And the liver can also make glucose. That's called gluconeogenesis, which is the formation of glucose. Basically, the take-home message is liver stores glucose. We need glucose, so sympathetic neurons tell the liver to release the glucose. Parasympathetic does the opposite. Again, when we're in resting mode, we don't need high blood sugar, so we will convert glucose into glycogen and store it in the liver. So we do that when we're at rest. Adrenal glands we already talked about, stimulated by sympathetic neurons in order to release epinephrine from the adrenal glands. And epinephrine, one thing it does is it helps release more glucose into the bloodstream. Again, we're looking at energies here, so epinephrine causes the liver to release glucose. Parasympathetic, no known effect. Okay, next organ, we're kind of sticking with adrenal glands. Sympathetic stimulates the adrenal glands to release epinephrine, norepinephrine. Parasympathetic, no known effect. Lacrimal glands is a parasympathetic response, production of tears. Pancreas. Now, pancreas is another important one. One of my favorite organs is the pancreas. Pancreas is involved in a couple of things. One is it produces digestive enzymes. Remember, digestion is a parasympathetic response. So sympathetic neurons inhibit the production of the digestive enzymes, whereas parasympathetic stimulates the secretion of digestive enzymes. Pancreas also produces insulin, which helps store glucose. So we're storing glucose in our parasympathetic mode, so it's going to cause the secretion of insulin during parasympathetic. It inhibits insulin in sympathetic. The opposite hormone to insulin is glucagon. So if you inhibit insulin, you're going to promote glucagon. Glucagon helps, again, release glucose. So it's all about releasing more glucose into the bloodstream. Sweat glands, stimulated by sympathetic neurons. One difference is the sweat glands contain acetylcholine receptors. No known effect, parasympathetic. Digestive glands, this should be an easy one. It's all about parasympathetic. Rest and digest. Whereas sympathetic neurons decrease the production of digestive enzymes from digestive glands. Last page. Alright, let's look at the iris. The iris is what controls the size of your pupils. When we dilate the pupils, we take in more of our environment, so that's a sympathetic response. Constriction is parasympathetic. Ciliary muscle, which we'll talk more about when we get into the eyes, is used for distant vision. So we want to see more distant sympathetic mode, taking in your environment. Parasympathetic is better for close vision. So when we're resting, we're better at being able to read close up. Right? It's very difficult to read a book when you're exercising. It's very difficult to read close up. Now you can watch a TV from far away, but if you've ever tried reading a book while intensely exercising, it's pretty difficult because it's hard to see close up when you're in sympathetic mode. You need to be resting in order to read. Bronchial muscle. So the bronchial muscle is all about letting more or less air into the lungs. If you bronchodilate, your airways get larger and more air can enter the lungs. That's a sympathetic response. And again, air carries oxygen. We need oxygen for energy production. So we're going to dilate our airways using sympathetic neurons. Parasympathetic neurons constrict our airways. When we're at rest, we don't need a lot of air in our lungs because we don't need a lot of oxygen for cellular respiration. There's a lot of drugs. We talk a lot about these two drugs when we get to the respiratory tract. Beta 2 agonists will cause bronchodilation. So we use those to increase air into the lungs. Classic example is albuterol. It's a drug that's used as a bronchodilator. People who are having trouble getting air into their lungs can use a bronchodilator. Those bronchodilators are either beta 2 agonists, agonists mimic, so they're going to do bronchodilation. They're going to activate beta 2 receptors. Anticholinergics block these cholinergic receptors, therefore it'll do the opposite of constriction. They will dilate. So two ways to dilate the airways. You either use a beta 2 agonist or you use an anticholinergic. Gallbladder. Gallbladder is used in your digestive system, so it's stimulated to contract and release bile using parasympathetic neurons. Stomach and intestinal muscles, that's all rest and digest, so that's parasympathetic. Urinary bladder, that's all rest, so you urinate because of parasympathetic neurons. You'll notice that if you're ever exercising, you rarely have to use the bathroom. Right? If you go run on a treadmill for an hour, rarely will you run for a half hour and realize you got to use the bathroom, because your parasympathetic neurons are turned off and you don't contract the detrusor muscle of your bladder. Finally, erector pili muscle, that is a sympathetic response. Erection of the hairs is a stress response. So these last three slides, there's a lot of information on them. You got to go through each organ and kind of know the why. Why would the sympathetic neurons do this? Why would parasympathetic neurons do this? All based on, do we want to activate organs that are useful during stress, or do we want to activate organs that are useful during rest? So that's the end of our autonomic nervous system. Please bring questions if you have questions to class. Autonomic nervous system is something that's not going to go away. We refer to it quite a bit in A&P2, and the autonomic nervous system is probably going to make up about a third of the last exam. So it's going to be a fairly decent chunk of exam 5.